Hi, Malika. Thank you for your time. I'm Irene Papaconstadopoulos. I'm a board-certified pediatrician, and I've been working the past 2 years in Kahului on Maui with Dr. Frank Baum. I just wanted your time just to let people know about a couple of issues currently.
So why don't we start talking about those issues? What is the current state of need for you folks with protective equipment?
So fortunately in Maui, we're a couple of weeks ahead of the rest of the world, so we can actually see what may happen. And we haven't really seen the shortage, but we know that there is a shortage, and the supply chain from the rest of the US and from the world is not going to be enough if we start seeing cases on Maui. And Maui also has the little special thing that physicians are also in shortage. So we have about 166 less physicians that we need here, not to talk about nurses and physician assistants. And the majority are actually, the average age is higher than the rest of the US. So some of the physicians are actually themselves in the high-risk group. So we can't tolerate, having any physicians or healthcare professionals or any first responders being sick or having to self-quarantine for 2 weeks. And we know that we're not going to have enough face masks. The hospital won't have enough if they're seeing a lot of patients, N95 masks. I want to, of course, disclose that I'm in private practice, so I'm not a representative for the hospital. And I'm getting all the information from the CDC and from the World Health Organization, from the American Academy of Pediatrics. We know now that the CDC has updated its guidelines about use of face masks, and we're doing now a crisis management, so really expecting a shortage. And that means using the N95 masks. Those are the ones that seal and can actually protect from aerosol. Using those masks only with health care professionals when they're going to do a procedure that they may actually be exposed to droplets. So for all other, when we're just examining, we're going to use the simple surgical masks. And many civilians have, as expected, bought a large amount. And so we're trying to reach out to the community and tell them that if you do have extra at home, you can actually do a huge brave step as to giving some of those, either donating or just calling your doctor's office and asking, do you need some supplies? Do you need gloves? Do you need extra sanitizers? Do you need these masks? That's the most important thing right now that people can do.
Yeah, I have been doing some research and looking at the state of affairs on the East Coast and other parts of the country where they've already run out of masks. And so they're having to go to these dire measures of using bandanas or, just pieces of fabric over their mouths. Can you talk a little bit more about that?
So the CDC does say when you do run out completely of masks, you can use any alternative you have, and that does include bandanas. Of course, it does clarify that there has been no research of how much these fabrics will protect, but in these cases, you take any measure you can. So right now, again, it's the N95 masks, save them. You can actually reuse them in some cases, or actually use them beyond their shelf life. And then if you run out, you can go to these resorts as bandanas. But right now, I would ask any person at home, because really individual action is going to make the big difference right now. We can't wait for the supply to start sending more. If they have extra at home, if they know anyone, they may have masks like the N95 masks in stores that are mostly for painting or for home construction, and people may have these actually at home. Just call your doctor's office, call the hospital, and see if they would like some extra. And they can, even if each person gives one, it's going to make a big difference.
Right. Okay, so to recap, and let's just clarify too, it's not just physicians in the hospitals, healthcare providers, it's also our first responders that are running dangerously low on these types of PPE equipment to protect themselves from getting the virus. They're the ones that need to help us. So if they catch this, and as you were saying, a lot of our physicians and nurses are in that are in the older age group, and so they're in the higher risk category. We can't afford to lose these people. We can't afford to lose anyone, but these are the ones on the front lines helping to save others. So I know a lot of people have wanted to help, and the ways that they can help are, number one, if you have the proper equipment, N95 masks and other things that are usually stocked for our healthcare workers and our first responders, you have those somewhere in a back storage, or maybe you've hoarded them, or whatever the case may be. No questions asked. You can donate these, or in some cases, maybe they might even be open to buying this type of equipment. So go ahead and reach out, call your hospitals, your doctors, and others who you think might be in need of this, and that's how you can connect. I saw an Instagram page called Med Supply Drive, and on their page, what they're trying to do, they were featured by Oprah as well, is they're reaching out to any research facilities. So, scientists, whoever it is that could have these types of this type of equipment somewhere laying around, we need it now. So that's the first thing you can do, is give us the proper equipment. The second thing is, God forbid we run out. And now we're having to go to bandanas and other things like that. There are patterns online, and, the community can sew these things and have them available. We hope that that's not what we need to go to, but if we do have to go to that, that is a help. And I guess those are the two ways, huh? And spread the word.
Also, the social distancing. So if you aren't close to other people, you don't have to wear the mask. If you have symptoms and you're coughing and you're going to be closer than 6 feet to someone, yes, you should wear a mask. But otherwise, you don't need to wear masks just to walk around. So don't use something that can actually be used for someone as first responders that are going to be in close contact with cases. The second thing is that call your physician's office if you have scheduled appointments, or if you're considering going in before you go in. Most, if not all offices right now, have changed their policies, so there are no walk-ins. They want to triage by phone. We talk with them on the phone before, even using telehealth before they come in, and to see if they really have to come in, if they have to go to the hospital directly, or if they can be seen in their office, to decrease, exposing anyone in the office, even the staff. So we shouldn't forget the staff in the offices that are working and keep these offices open.
All right. Well, thank you so much for letting us know about this concern and how people can help. I know a lot of people are self-isolating, and maybe they've got some time on their hands where they could help to either find this type of equipment that can then be donated or bought by the healthcare professionals and first responders that need it, or maybe they have the stuff lying around themselves and they can be of use. So thank you so much for letting us know. Everyone, stay tuned to Maui Now for everything Maui Always Now.